welcome the second guest on our show. The Delhi government has announced that it will now provide 450 additional types of medical tests free of cost to the public at government hospitals across the state. To discuss the impact of this move, we are now joined by Dr. Arvind Lal, who is the chairman and managing director of Dr. Lal PathLabs. Sir, good morning. Thanks a lot for joining us. You do have a considerable exposure to the Delhi market as well. So can you quantify that for us, and what would the impact of this move from the Delhi government be on a company like yours?
Sonal, it's a step in the right direction and long overdue, at least to my mind. In the Constitution of India, it is written very clearly that every citizen of India shall be given free, high-quality treatment and diagnostics, if you add that, for all times to come. So I'm really happy that some government is doing it. And it's not that they were not doing it earlier. They were already having about 200, 250 odd tests. They've only increased the test menu to 400. So the impact on us will be minimal because we cater to a different segment of the society. And this is not a COVID test which has to be done by everybody at one, test price. So these are compartmentalized, kind of offerings which will always be there. And I always give the example of the Indian Railways, whether you travel, unreserved second class or reserved second class or first class first or whatever in between, the train is going from point A to point B. But you're all different quality of service. A person who is, sitting in the second class unreserved cannot be made to sit in the first class first compartment. And so is this practiced by Air India also and many other industries. So I'm under no, illusion that this is the right step for us, for the government, for the people of India. And we will also greatly benefit from this because somebody is now putting its eyes on testing. And if you remember, even during COVID time, what was the policy of the government? Test, track, and treat. So this comes under the first segment, which is testing part. And I'm so happy that the government of Delhi is doing it.
We get that point, Dr. Lal. It is a great populist move as well, and someone is focusing on the tests. We also understand that the clientele that you cater to will be different from this. What we're trying to figure is what proportion of your revenue comes in from Delhi. And because these number of tests have been increased from 250 to 400, do you think you could face any sort of incremental revenue loss? And if no, then do you think there can be a possibility of you getting more revenue because some of these guys will outsource it to you? Are any of those possibilities on the cards?
See, Mangrab, the testing for a patient doesn't happen, just by offering one or two tests. So the whole gamut of testing. And for example, take the disease diabetes. So blood sugar, fasting and PP is just the beginning. After that, there are many more sophisticated tests, both in blood and urine, which I won't go into. So you can imagine that the people are dying under the impact of the non-communicable diseases or lifestyle diseases, in which diabetes is number one. So once the Delhi government has found out or been able to discover many more diabetics than, presently, all those people would probably come to us for a second referral check. And also there's a great possibility that the further testing will also be done by people like us.
All right. And the second question I had about this itself, and this is a worry, is that close to Delhi is Punjab, and there we have our government as well. What if this was to be announced in Punjab? What proportion of your revenue comes from that state, if you could give us a sense? And you haven't told us how much comes in from Delhi. Delhi, I presume, is around 20-25% of your sales.
Well, I'm not a finance guy, so I won't get into the figures because, I can give you a wrong figure. But what I'm saying is that we are no longer a Delhi, concentrated service. We are a 73-year-old pathology lab testing service. And yes, we did start from, Connaught Place area. Then we went all over NCR. Then we went, rest of North, etc. Let me tell you what we are all up to. So we cover the whole of North. We cover practically the whole of the central region, the whole of the eastern region, Last year in November, we acquired the number 2 lab in Maharashtra. So we are very well, represented in the Western region. And it's a question of time that we also make our presence really felt. We are already in the South, but with the, slightly more offering, we can be there. So as far as we are concerned, we are now running more than 277 labs, 5,000 collection centers, etc. And last year we tested 2.75 crore patients.
Okay.
So this is not going to make much of a difference. And in fact, I'm really happy that somebody has thought about the urban poor.
Yes.
The shift from the rural areas to the urban cities is now very well there. I have read a report in which now they say that no longer 70% people live in the rural areas, now about 55 or 60% only. So the rest of these coming all into the big towns like Delhi, Mumbai, Calcutta, etc., etc. So I'm glad that Delhi government has done what it has done, and it will, give a common man a big fillip as far as his health is concerned.
You are
and
right,
also
Mr.
the health spending will increase, which was, not up to the mark so far.
Yes, Dr. Lal, we take your point, and thank you so much for joining us and telling us that, yes, it's not a big impact on the company, so to say, because definitely your shareholders, when this news was announced yesterday, were worried because the stock was lower. So this clarification would surely help them as well, because they also were looking forward to the clarification coming in from the company, because the worry was that it could possibly impact the financials or the revenue, so to say. Thanks a lot for joining us and clarifying that.